Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, I want to sort of change tracks and speak on a particular topic that I'm sure most people today are not paying attention to unless they've been affected by it. And what I'm speaking of is oral cancer. You see, to bring this topic up to your everyday person, layperson who's not in medicine, there's sort of this raise of the eyebrows and as if not much thought is given, has been given, or even discussed. Because a lot of times when people think of cancer, they think of lung cancer, breast cancer, pancreatic cancer, stomach cancer, ovarian cancer, and then it begins to wane. As if cancer can only affect those areas of the body, and it's not the case. Cancer cells can metastasize anywhere in the body. But for this episode, I want to talk about oral cancer, because there have been patients that I've referred to oncologists that were presenting with certain signs and symptoms that fit this description, but I'm not going to go any deeper along that track. But, some of these symptoms, many individuals take for granted. They overlook it and feel that it'll pass. And many times it just simply gets worse. You have to understand, oral cancer is cancer of the mouth that tends to affect the tissues of your throat, your gums, your lips, and under the tongue, your tongue at its base. Okay? And this type of cancer, it doesn't always cause symptoms in the early stages. But the cancer cells of this type of cancer can spread very, very quickly. All right? So this is why I really wanted to discuss this today, because if you're experiencing some of these symptoms, along with seeing an acupuncturist, it may be best you bring it up with your general practitioner or request to see an oncologist. Because oral cancer is a condition that can become very dangerous if it spreads to other parts of your body. And that usually happens in about anywhere between 3 to 8% of oral cancer cases. But now the one positive sign is most cases of oral cancer tends to be treatable as long as you catch it early. Because if you don't, and again, if you ignore the symptoms, whereas now the cancer is going untreated, the symptoms are going to get worse. They are definitely going to get worse. Now, to jump right into some of the signs and symptoms of oral cancer, let me think on this. I know one is like, if you notice persistent sores on the tissues of the mouth, the gums, or your tongue, or your throat, or your lips, to an acupuncturist, its presentation would present like most of the signs and symptoms of oral cancer as heat toxins. Okay? But if you're noticing persistent sores on the tissues of your mouth or your tongue or your gums, throat, or your lips, see an acupuncturist right away, and consider seeing an oncologist as well. Other signs can be like red or white patches on your throat. Now, some individuals don't pay attention to their throat or attempt to look at it. And your general practitioner should, like when they put the stick in your mouth and, shove a flashlight down there, tell you to say, and you're annoyed with it, which I am with my annual checkups, sometimes semi-annual. They should be able to notice that and then take measures to assure themselves that it is not cancers or cancer, oral cancer. Because your general practitioner, just like every acupuncturist on this planet, would and should understand that health is wealth. They should also know that the wealth is not in your wallet, it's not in your pocket or your purse. Medical doctors should always know that the wealth is not in your bank account or your retirement or investment account or in the stock market. And medical doctors should also know that the wealth is not under your mattress and it's not in the shoebox in the closet, and that it's in you. And as long as you're going for your annual checkups, be it the fact that nothing is wrong the other 11 months, 3 weeks, and 6 days, if they saw red or white patches on your throat, they would know what to do. Now, here's something you would have to tell your acupuncturist is, do you experience numbness in parts of your mouth or your tongue? That is important. Like, when you go to the dentist and they numb your mouth before they do whatever they have to do, are you experiencing that or anything close to that, anything resembling that, and you haven't been to the dentist? Make sure you tell your acupuncturist at your wellness visit. Do you also experience bleeding in the gums or your tongue and lips? Now that's another warning sign. But these are things, these signs of excess heat patterns, and acupuncturists will pick that up right away. Clearly pick that up in the intake. But what about sore throat? What about loss of voice or hoarseness? Are you experiencing that? That's just something else you're going to talk to your acupuncturist about. Any of these symptoms, don't overlook it. Don't take it for granted. Oh, I'll get over this. Especially if you have a sore throat or hoarseness or loss of voice, but more so hoarseness. People will let that drag on for a while before it just becomes too annoying. But you don't want to do that. Same with the sore throat. If it doesn't correct itself within 24 maximum, and I don't even push it to 48 hours, you need to tell an acupuncturist or your general practitioner. But here's another thing that's key. Like, do you experience any pain or difficulty when you're chewing or talking or even swallowing? Now that can be quite scary. With pain or difficulty swallowing, that is like a huge red flag. Now, in that case, you're not only going to tell your acupuncturist or an acupuncturist, but you're going to tell your general practitioner as well. These things are important. And you know what else is important right now is I need you to put everything down. I need you to stop doing whatever you're doing, whether you're lifting something heavy and you're at work, or you're moving furniture around your house, or you're in the gym. Just put everything down. If you're crossing the street, I need you to hurry up and safely get across the street. And if you're operating a vehicle, I need you to either pull it over to the side of the road or land at your nearest airport. Because now I need you to close your eyes. And I need you to say to yourself, acupuncture is my life. And now open them. Boom. You are now brand new. And brand new you are. Now, another interesting symptom that should set off all types of alarms is, do you feel a lump in your neck? Now, you know that does not belong there. Definitely does not belong there. And of course, you're going to let an acupuncturist know, along with your general practitioner. But here's something that's pretty interesting. Like, do you ever experience any difficulty moving your tongue or your jaw? You should not, especially your tongue and your jaw. You talk. Your tongue is like always moving around, whether you're eating, drinking, talking, even a lot of times when you're sleeping. So if you're experiencing difficulty moving your tongue or your jaw, there's problems. Red flag again. All of these are red flags, really. You know. And another one is, you notice any swelling of your jaw. Not good. Not good. Another is ear pain. Do you experience any pain in your ear or ears? That's another red flag. Okay? But the key here is, if you're experiencing any of these symptoms, you really want to contact an acupuncturist as well as your medical doctor. Because oral cancer can become a medical emergency due to complications or even severe side effects of treatments with your oncologist. You know, because you can, like, if you're undergoing cancer treatment, you should definitely have your own acupuncturist. Because the side effects of chemo and radiation, acupuncture is very effective in dealing with it. You know, because you can experience fever, chills, nausea, vomiting, shortness of breath, severe headaches, neck stiffness, blood in your urine. If you find out that you're suffering from oral cancer and you're getting chemotherapy or radiation, make sure acupuncture is a part of your life. Because acupuncture is my life. What's yours?